Good morning, good afternoon, good evening, everyone. So this is Basanta Joshi. First of all, I would like to thank Asian Health, Asia eHealth Information Network for providing me this opportunity to share about the establishment of Virtual Interoperability Lab at Institute of Engineering, Tribhuvan University. So Christian has already introduced myself. So, but I would like to talk about few things which Christian didn't mention. So I did my bachelor's and master's from the same institute, Pulchok campus, under Institute of Engineering. And then I did my PhD from Osaka Sangyo University, Japan. So during that tenure, I was working on the application of AI for motion tracking. And after returning from Japan or before going to Japan, I was working in the software industry. So where I was working on data analytics project, I was also working on different types of application of AI related projects. So especially after returning from Japan, I'm actively involved in natural language processing research, medical data related research, big data related research. So and also I've been part of multiple national and international projects as an IT consultant. So I'm also, as Christian mentioned, I had a privilege to be part of AeHIN community as working council members for the year April 2025 to March 2026. So in this talk, first, I will be talking about IOE a little bit. Then I will be talking briefly about the activities of IOE and CARD related to the medical domain. And then I will be talking about the need for establishment of virtual interoperability lab in the context of Nepal. And then I will be talking about our objective and then the activities after lab establishment, especially related with collaborative and capacity building activities and the plan which we have in for future. So talking about the IOE, it's actually the organ of Tribhuvan University, and about 16,000 students, undergraduate students, and about 3,000 graduate students are studying in IOE. So basically, when we talk about the history of IOE, it was a technical training institute, and it was later reformed into Nepal Engineering Institute in 1968. And then again, after merging different working in different capacities in Nepal and across the globe. So IOE has its own governance bodies. So talking about Institute of Engineering, we have a dean as executive head, and then we have assistant dean for different purposes: academics, administration, exam, and planning. So all these assistant deans control the different activities. Academic council and faculty board of so talking about the Institute of Engineering, we have a stand-in working for different departments. We have research centers. So different research centers actively involved in research and collaboration activities with national and international agencies, universities, and all the government institutions. So I am representing Center for Applied Research and Development. Talking about other components of the Institute of Engineering. So there are 10 affiliated colleges and 5 constituent campuses. These are the public campuses. So I am the part of the Pulchok campus, which is offering 6 bachelor programs and 22 master's program and running PhD courses as well. There are other public campuses: Thaptali campus, Eastern Region campus, Western Region campus, and Chitwan Engineering campus, offering different bachelor's and master's programs. So whenever if we see the number of bachelor program offered at Institute of Engineering, there are 12 streams from civil engineering, architecture, electrical, electronics, mechanical, computer, aerospace, aerospace, agriculture, industrial, geomatics, automobile, and chemical engineering. So based on this, we have specialized master's courses. So due to all these students and faculties, we have a strength to handle different types of research project, different types of projects that is required by the different national and international organization. So we have different public and private campuses. At in the moment, we have 10 private campuses and 5 public campuses, and we are planning to establish a public campus in another region of Nepal, Dang and Khaftar, very soon. So talking about the collaborative activities with different organizations and different uh, like universities. So I have listed very few, since AeHIN is already in the my slide logo, so I haven't highlighted the AeHIN in this list. But we have different collaborations with the international universities in Norway, China, Japan, Korea, Thailand, Indonesia, Europe, and America. And we have a very good relationship with different universities in India, especially IITs. And also we have a collaboration with GI, AWS, Daikin, Airbus, Samsung, and others. So we have a very good collaboration through different departments of our university. Similarly, we have a local collaborations with different ministries and Department of Nepal, and these are some of the companies which have a good collaboration for especially for the IT students. And when we conducted our survey, so we found that most of our students are working in Nepal telecommunication, especially for the IT. Since I'll be more talking about the my department, electronics and computer engineering department, since this is the some of the survey which I have done through my department. So most of the students are working on telecom industries, and other students are working in different companies, software companies, and some of them are working in the IT section of the government, and also other interdisciplinary ministries as well. So we have also our alumni working in different multinational companies, like we can see the logo. So with all these strength, we have very good alumni who has been profound experience in working in all these organizations. So based on that, we have established a partnership with national and international institutions, both government agencies, non-government agencies. So we have been doing a collaborative research. Similarly, with all these collaborations, we have been able to do capacity building and exchange programs. So with the support of our alumni, with the support of the universities in which we have collaborated, we have been able to train our faculties and students. And also we have been conducting different workshop and training sessions. And further, some of our departments are doing consultancy services. Sometimes we have been doing material testings. Sometimes we have been designing for like government organizations like Nepal Electricity Authority. Sometimes we have been designing for road department, and very few cases we have been working with the health ministry. I am been a part of one of the committee in the Ministry of Health and Populations, where we have been dealing with eHealth and digital health roadmap and all these things since long time. But I have been just working as one of the member representing Institute of Engineering. Similarly, we have been publishing and disseminating research findings through journal papers or our publications. So I'm highlighting very few things which has been done in the context of digital health domain. So actually, during the COVID time, we were planning to conduct, before COVID, we were planning to conduct some courses related with health domain, digital health or health informatics in our institution. So that's during that time, we have consultative meeting with medical doctors, IT professionals, and medical domain experts regarding the possibilities of conducting digital health courses for especially for IT students, so that IT students can know the medical terms. Similarly, in that meeting, we also concentrated providing same course to medical doctors, so that medical doctors will know the terms related with IT. So we just did some consultative meeting. We submitted the proposal to GIZ, but since then we didn't get the response, and so we haven't been able to conduct those courses. So as a part of this laboratory, we want to conduct those type of courses. Similarly, with the AeHIN support, we actually conducted a datathon where students were provided with openIMIS DRG dataset of Thailand, and they actually conducted the similarity with the Thailand database and Nepalese database, and what are the upgrades we need to do in the openIMIS in the context, especially in the context of Nepal. So some of the students were rewarded with some prize during that datathon. So talking about the other activities being done by our institute, so there has been a lot of health domain related project works being done by our students, especially graduate and undergraduate students, and they have been doing in the area of data analytics, in the area of machine learning, in the area of different types of medical domain like cardiology, radiology, and dermatology. So all these areas, they have been doing some research works, but especially the collaboration is still lacking. So we get the data, sometimes we get the data set from the internet, sometimes we get the data set from the some of the departments in like hospitals, but we have not fully collaborated. So now this lab will provide us a platform for collaboration. We have done some data analytics regarding diabetes. So we got the data, and so we actually visualize what are the diabetic cases in the context of Nepal through the map of Nepal. Similarly, we had one student working on like a fatal cardiac diseases. So they actually got the data from some hospitals in the Nepal, and they actually classify whether the fatal heart is vulnerable or not. So those kind of research we did, but especially we applied like machine learning algorithms, and we sometimes perform data analytics. So these type of activities were done by the graduate and undergraduate students in our university. So what we can say is we have been doing some work, but and also the ministry has been doing some works regarding the transformation of the ministry itself. So they have been part of GIZ initiative. They have been part of WHO initiative. So they have actually conducted different types of workshop, and they have designed the eHealth strategies, and they have also established standard interoperability lab in collaboration with GIZ. But still, the problem what exists in Nepal is like whenever they actually doctors are, whenever we actually I'm sharing the experiences that has been shared by some of the doctors in Nepal. So what we see is doctors are really overwhelmed by the patients. So they actually sometimes one doctor has to see hundreds of patients in a day. So they are actually overwhelmed by the number of patients. But what we can do is, so we have done a lot of projects. So students are doing a lot of projects. That intervention is not adopted in the health. So sometimes in the remote areas of Nepal, the people are dying because they are not getting the support that has to be given by the health post or lower level health departments in the country. So, and we don't have appropriate telemedicine initiatives. So what we can do is we can collaborate with the ministry, we can collaborate with hospitals, and the work that has been being done in our institute, we can collaboratively do and assist the patients in the remote places, assist the doctor to make the quick decisions. So those kind of things we can do. So that's why, and also we can see that there are a lot of initiatives being done in collaboration with the GIZ, WHO, or other national and international organizations, and they have been developing a lot of systems, especially in the context of health information system. So we have, as per some of the information provided by the ministry, we have 70 plus health information systems. So we have a lot of health information systems, but those are not integrated. So we cannot share the information easily. So sometimes when there was a COVID, it was not easy to share the information across the hospitals. So ministry was like pushing the hospitals to share the informations regarding ICU, regarding the ventilators they are available. So we have lack of collaborations. We have limited IT trained human resources in healthcare. So we have lack of interoperability. So in that case, this lab will help in producing. IOA has been producing a lot of technicians and engineers through its diploma and bachelor's and master's program. So what we can do is we can collaborate with the alumni, we can collaborate with the health institution and co-develop so the tailor-made solutions for Nepal's healthcare landscape. So I highlighted very few problems. So we can collaborate with them, and then we can develop some of the solutions. So so that's how we devise the objectives for our lab. So actually, what we can do is we can equip IT students with the skill and knowledge. First of all, related with the healthcare problem. So we can introduce with the healthcare terminology. We can also organize knowledge sharing and capacity building sessions, especially related with the healthcare terminology and with the standards in healthcare domain, and also the interoperability. We can actually collaborate with the different agencies to find the grants to develop some of the works using both collaborating with the medical domain. Similarly, as I mentioned earlier, we can co-develop some solutions, especially in the context of interoperable solutions. Similarly, we can collaborate with the Standard or Interoperability Lab Nepal and Ministry of Health to support all of these activities. So to do that, we also need to conduct some courses, especially tailored for the IT students. In our department, we have electronics and computer engineering students. So we have to tailor our courses for especially the electronics and computer engineering. Similarly, we can collaborate with the existing projects with the national and international other universities or industries. Similarly, our lab can provide some supports to government for digital health innovation, intervention, or in making some policies or even implementing those things. So that's how we conceived our lab and established our lab in collaboration with the Ministry of Health, in collaboration with AeHIN and also GIZ. So currently, I am the cluster lead of this interoperability lab, which is formed under virtual lab, big data and computing. So that's how we renamed the lab as big data, interoperability and computing. So these are the members uh, in the lab who are the faculty in our department, and we try to get the permission from the faculty, senior faculty, Professor Dr. Suvarna Sakke to be as a member of this lab. Similarly, we got the permission from Dr. Alvin Marcelo to be a part of advisor in this lab, and also we got the permission from Professor Dr. Gones Unelkar, University of South Florida, to be part of the advisory members. And also, without the students, we cannot further do the activities. So undergraduate and graduate members of our electronics and computer engineering department can be the associate members of this lab. So some of the students has already been a part of this lab. So with this vision and mission, so we actually did a kickoff meeting by inviting the representatives from Ministry of Health, GIZ, AeHIN, and WHO on Chaitra 3rd to 2081. And actually, there is a guideline proposed by Standard on Interoperability Nepal. So we adopted that guideline, and so we propose our operational guideline based on this. And also, we will be soon establishing biomedical engineering at Institute of Engineering. So we took that opportunity to discuss about the preliminary draft of biomedical engineering syllabus in that case, and the participants highlighted indoors that we should also add the health informatics and courses related with health informatics, interoperability, health data analytics, and all health data related image processing, and all these things, medical IOMT, Internet of Medical Things, and all these things were raised during the discussion session. So based upon that, we actually formed the vision and mission for our lab. So the vision for our lab will be leading national hub for innovation, collaboration, and capacity building in the field of digital health interoperability. So what we will be doing is we'll be training, we'll be collaborating in a team and developing some tools that will help to do some innovation in the digital health domain, especially in the context of Nepal, and we will be testing the tools developed. So the organization structure of the lab will be, as I already mentioned, it's a part of the department. And then there will be lab coordinator and advisory committee members, and the core members will be faculty and researchers from the department, and also associate members will be the students. We will be external advisors from different stakeholders, and we will be collaborators, those from the collaborating agencies. So what we did was first we actually discussed with the faculty members, and then we the core members of the lab, even though we say it as associate members, will be the students. So we actually developed a Google form, and there were 82 interested students, both from graduate and undergraduate courses. So we actually did some survey from the students, and we actually tried to find out what are the areas the students are interested on. So when we So when we try to find out this interest and the areas of the students, so we found that especially since the students of electronics and computer engineering were interested, so their main career goals was AI and machine learning. And some of the students were also interested on health informatics, and some of the students were also interested on digital health and medical technology. They were also interested on other areas, and some of the areas that will match with our department as digital health standards, and also innovation, and also healthcare impact, and entrepreneurship and biotechnology, and all these things. So these were the career goals of interested students. And similarly, we try to find out the expectation of these interested students from the lab. So some of the students highlighted the big data as one of the expectation from this the lab. Also, they were thinking about digital health systems also, and they want to learn more about the digital health intervention through hands-on experience. So our students were interested on hands-on experiences regarding health informatics, interoperability, and all the digital health intervention happenings in the currently in the around the globe. So based on that, we actually organize different activities. So very few activities. So for the initial establishment of the lab, one of the activity we conducted was through the collaboration of University of South Florida. Professor Dr. Bhuvanesh Unelkar from University of South Florida was visiting our lab, visiting our university. So we took this opportunity to conduct a guest lecture on AI, machine learning, and explainability. And we talked about the digital health intervention on that. And also, since he was doing a lot of publications, he also highlighted our students from Pulchok campus, and students and faculties from Pulchok campus and Paschimotchal campus, west of the Kathmandu. So both departments, he actually conducted these two sessions, and we also explored the possibility of AI application of machine learning, AI, and explainability in health domain as well. So we also collaborated with the university in Japan, Chuyu University. Professor Dr. Atsushi Ito is here in Nepal to conduct the research on brainwave. So what we did was we took this opportunity uh, to go to ABC Trade, Annapurna Base Camp, that is located in the mountainous region. And so we actually travel by flight to Pokhara, and then we go through the hiking route, and we reach up to 4,030 meters, and we actually collected the data. So these are the walking trails. We actually the total days were 7 days. We walked for 7 days, and we walked through the jungles. We walked through the different difficult trials. So we actually use the brainwave sensors to collect the data for our like happiness moments, fatigue moments, and all these moments. So this was the he is the Professor Ito. He's a Professor Ito. So we actually collaborated with us, and then actually we went to the top of the base camp, which is located 4,130 meters. And so we actually use these devices. So we can see that in our forehead, this is brainwave sensors. So we use these brainwave sensors. So we use GPS sensor as well to, and we store the brainwave data and GPS data in the these. So, and we are still doing the, we just complete the collection part. Now we will be doing the analysis part. So this type of work we did in collaboration with Japanese university. Similarly, as I mentioned, since students were interested on knowing more about the digital health ecosystem and interoperability, we actually invited the experts from different organization in Nepal. So now I will be talking about the capacity building activities that is done by in my lab. So we actually invited the local experts. So, and we conducted the capacity building session on digital health ecosystem and interoperability. And we invited the doctors as well. They shared like how engineers can bring innovations to the medical domain. So we discussed about that as well. We invited the persons who are working in digital health for a long time and who have been giving inputs to the government. So we invited the experts in the medical domain, and actually they are belonging to the IT background. So all these trainings were done for the capacity building of the faculties and students in the context of digital health ecosystem and operability. So we invited Mr. Nirmal Dhakal from GIZ. We invited Mr. Sasank Nepani, IT advisor from Ministry of Health and Population. We invited Mr. Sanjay Paurel, who was actually earlier lead of Standard Interoperability Lab in the ministry. And also we invited Dr. Nitin Bhandari. So these were the activities by inviting local experts. Similarly, we had the privilege of inviting Dr. Alvin Mancelo, who was a previous executive director from AeHIN, and he actually shared a lot of things to our faculties and students who joined. Almost 40 members from our department joined the session organized with the help of Dr. Alvin. He actually talked about Asian Health Informatics, Asian eHealth Information Network, and there is a community of interoperability labs. He also talked about that and the possibility of collaboration with that lab, with our lab at our institute. And also he talked about digital health ecosystem and interoperability happening in Asia. And especially he talked about the use cases that is being done in the Philippines, digital health. So, and students asked a lot of questions, and Professor Alvin answered the questions. And he also talked about some of the things, some of the intervention that is available in the community of interoperability labs, and also the Philippines lab itself, and our students can use that, and faculty also can be part of those projects. So so that is the activities done till now. So to further capacity to understand what student want to do in future, so we conducted another survey after conducting these sessions. So what we found was this survey was only conducted for the interested members in our interested members for our lab. So they said that they want to work on open source project. They said that they want to work for resource-based work. They said that they want to work on use of artificial intelligence and machine learning for health domain. So, and some of the students also said that they want to work for health data analytics. So these are the major areas our students were interested on. Some of the students also talk about working on the project which we were doing, brainwave signal analysis, and also IoT, and also health app development, and also decision making for mental health, or maybe clinical other clinical decision making domains. So these were the things students interested on. Similarly, as I mentioned, our lab wanted to offer a elective course to the students of our department. So we asked, what type of elective course you want? So most of our students were interested on health data analytics, and some of the students were interested on health informatics as well, and digital health. So these were the elective course. One of these elective courses we will be offering in collaboration with AeHIN and GIZ. So in future. Similarly, we asked our students, we have not listed a lot of topics. We just asked what type of training or session you want to have in future. So we just organize a primarily digital health ecosystem training sessions. So those students said that we want extensive training on digital health ecosystem. We want extensive training on interoperability. We want extensive training on FHIR, openIMIS, HIE, and they also mentioned in their comments that they want hands-on experience. So our students want hands-on experiences on the technologies that is being used on digital health ecosystems. So based on all these surveys and feedbacks given by the students, so we actually did some consultative meeting with the ministry by inviting the former director, Mr. Ramesh Subedi, and former lead, Mr. Sanjay Paudel, and also the current lead of SIL Nepal, Mr. Subhas Adhikari, and the current IT consultant to the ministry, Mr. Sasank Nipani. And we actually identified few areas of collaboration. So, so what we will be doing is, first, we will be conducting one of the elective course related with health and interoperability in our department. So that is one in our agenda. So similarly, we will be organizing the capacity building sessions on health standard interoperability, including hands-on training. So, and similarly, with collaboration with AeHIN, GIZ, and other stakeholders, we will be organizing workshop competitions related with, especially in the digital health domain, and in collaboration with government entities and international universities in our collaboration list, we will try to identify real-world project, and we will be assisting government in developing enterprise architecture, and we will be assisting government in developing core data data architecture for interoperability. So these are the things we will be doing in future in collaboration with different stakeholders. Thank you for providing me this opportunity to present some of the activities that is being done in our lab. Thank you very much. Looking forward to the queries and suggestions to improve the activities in our lab.
Thank you, Professor Basanta, for sharing about the developments in your lab at Tribhuvan University. So now we'll open the floor for questions and suggestions as well, if you would like to share any I think Sir Jai, our executive director, is raising his hand. Sir Jai, would you like to speak?
Thank you, Cha, and thank you, Basanta. I think this is a very comprehensive status of the various efforts that you and team from the university have put in, and then I also glad to see the kind of survey that you have generated. This is excellent. And then there is a whole lot of things that was packed with sufficient time still left for the discussions in this webinar. I really appreciate that. My question is related to, AeHIN has this rich history of, capacity building and trainings in the region in digital health, especially. But then, there is one particular factor that we may have to address. That is the career pathway, and then the opportunities within the ecosystem in the country. So, if, for example, the students from who are taking these courses and then the trainings that you mentioned about can actually get employed within the country, and there is a clear roles and responsibilities for digital health defined, and then based on these competencies, if they can get absorbed in the local system, that's an excellent investment that gets back into the country and then also leads to self-sustainability in the long run, rather than being dependent on external experts or grants. So that's the thing that I would like to share. Are there any efforts, or is there any clear plans? Like, for example, digital health courses, I'm aware of MSc in health informatics courses, but then after these courses, what are the prospects for the students, the candidates to get employed in the national health system? Are there roles and responsibilities? Are career possible for digital health, and are they is that clear, like how many of the students probably get absorbed into these roles so that they can actually contribute to the country? Thank you.
Thank you, Joingaresh ji, for the questions. So, you are actually, this is a very relevant question. So, we actually have to. We are planning to do one survey. We, like I mentioned, we did one consultative meeting long time ago before collaborating with AeHIN, I think. So we had a collaboration with GIZ. So in that consultative meeting, we invited representative from ministries. We invited a representative from government hospitals. We invited a representative from private hospitals, and also the people who are working on digital health intervention. So in that meeting, they highlighted that so a lot of things has to be done in the context of Nepal. So very few, like I mentioned in my presentation as well, so very few digital health intervention has been done in the context of Nepal. So there are a lot of opportunity, but the major problem is the health, like Ministry of Health is major stakeholders on deciding that. Before they haven't decided most things, but now they have a clear e-health roadmap. And also in the context of Nepal, there is digital Nepal framework, and it clearly mentions that health should be one of the important domain where we need to concentrate on digital health innovation. It has been prioritized. So definitely, currently, there are very few jobs, but definitely in future there will be a lot of job opportunities, and we will be collaborating with the ministries and to create specialized post for the students as well. Definitely, there are some posts already being created in some of the private hospitals, and also there are a lot of companies who are working on digital health intervention. So there are few opportunities currently, but in future there will be a lot of opportunities. Thank you very much.
Thank you, Basanta ji. Just one more comment that I will make. I think this came up earlier in my discussions with the colleagues from Nepal, as well as GI said. So, for example, there were some customization requirements or interoperability requirements that came up even with DHIS2. And, there were efforts made to reach out to his elsewhere, like, for example, in India, Sri Lanka, or something like that. So, if this the kind of efforts that you have made, and then actually also with the development and the progress that Standards and Interoperability Lab in Nepal is shaping up, it will be great to have the local ecosystem develop in such a way that you could even have HISP there to support, like this lab could actually support the interoperability needs within the country. And then unless, like if this can be like a cycle, like if there can be a means of whatever investments that are going into the interoperability labs that can actually get back in terms of whether government related projects for interoperability are from the industry within Nepal. That will be really good in terms of long-term sustainability of such investments. And then, of course, the students who are getting trained will also get absorbed. And then, there is a great pleasure of people working for their own country. Of course, there will be some who will go for abroad for other opportunities. I think that is also good in some way. And then one day or other they will return. But it will be great if the country is able to generate jobs prospects for such candidates. Thank you.
Thank you, Degresi, for the nice suggestion. So yeah, we actually, like in the survey mentioned by the students, they actually want to work on open source project. So we are really fortunate that we have a very good students, actually best among the students who are working in IT industry in Nepal. So we get those type of students, and so they are really interested, they are very passionate, and if they get the opportunity to contribute in open source project, they will definitely, I think, contribute. So before contributing on those type of work, so I think some of the trainings or sessions can be organized regarding what are the front end and back end and all those technologies that is being used in those open source software. So if they can get some sessions, I think they can easily contribute to those type of projects. And definitely, if our lab can contribute in the development of Nepal's digital health ecosystem, we will be happy to part of that. And since our students are coming on the cycle, so every 4 years they will move into the industry and another new batch of students will be coming. So yeah, we can actually make a cycle to for the contribution as well.
Thank you, Professor Basanta and Sir Jai. We have a new question in the chat from Dr. Karki. So my query is, what are the major challenges do you see for MOHP to implement the interoperability in health information system?
Thank you very much for the questions. So as I mentioned earlier in my presentation, that there are a lot of systems being developed by private institution and the government itself. So whenever we talk about these type of digital health interventions, so they are designed for specific use cases. So and they are designed by specific, sometimes they are designed by the open source project are designed by different universities or research institutions in the around the globe, and some of the interventions that will be designed by the local vendors. So the government sometimes will take the open source project and that way has been implemented, that has been developed by the some universities in specific use cases. So whenever we try to integrate the systems that has been developed by the local vendor or local use cases, what will happen is the so whenever I'm talking in some language like in Nepali or English, so the listener should understand the language that is being spoken. So if I speak in the Nepali in this session, maybe some of the people will not understand Nepali. So so that is the problems happening in the context of health information system as well. So the language that is spoken by one software will not be understood by another software. So in the context of Nepal, that thing is happening. So we need the system which can communicate with each other. We need the intervention that can communicate with each other. So currently, in some cases, what is being done is some cases with DHIS2, they are, instead of like communicating with the software that is being developed by the hospitals, they actually are developing the form in which we have to enter the data manually, rather than directly taking the data from the like the software that is being used by the hospitals. Similarly, in the case of like insurance-based system, that is like in the case of HIV or SSF, they are also getting the data from related with outpatient. They are getting the data related with lab. They are getting the data with pharmacy. So in that case, different hospitals are using different formats. So that is the challenge. So different hospitals are using different types of formats. So whenever we are transferring the data from the system one is used by one hospital to the central system, that can not understand the data being sent. So we need to like devise the standards for interoperability. So that I think that is one of the major challenge. And also another challenge is the IT people who are working in the digital health domain. They are not understanding the terminology that is used by the doctors, and in some cases the doctors doesn't understand the terminology that is being used by the IT professionals. So there should be some training for doctors. There should be some training for IT professionals, so that they can also understand, like software I mentioned. So there should be some training for both the doctors and IT professionals, so that they can communicate with each other and understand terminology that is being used. Thank you very much.
Thank you, Professor Basanta. Also, we'd like to ask if your lab can explore the inclusion of open source tools like openIMIS being used at the national level in Nepal.
Yeah, actually, what we are planning is we will collaborate with GIZ, who is looking after, we supporting the open initiatives. So to conduct some of the trainings to our interested faculties and students. So and in that way they will understand how openIMIS is being used in the context of Nepal. And similarly, our students, we will encourage our faculties and students to the webinars that is being conducted earlier by AeHIN, which is as you mentioned, different sessions are available in the YouTube channel of AeHIN. And also we will request AeHIN to conduct some of the capacity building seminars as well. And also after that we'll encourage, so some of the students are already doing case study in openIMIS, openMRS, I think DHIS2 as well, or some other health intervention, or BANI, that is being used in Nepal. So they are already doing some case studies. But if we can tell those students, okay, this way it is being developed, this way it is being used, so we can definitely do so, as Jay Ganesh mentioned. So we can customize some of the components of openIMIS or DHIS2 or openMRS for the context of Nepal as well, and for other countries as well. We can contribute to open source project as well.
Yes, thank you, Professor Basanta. I think we can have our last question now. This one is from Dr. Santosh Paudel. What kind of policies may we require in the coming days to implement interoperability in Nepal?
Thank you very much, Dr. Santosh Paudel, for the question. So first, what we need is, if we see the intervention that is being done by Community of Interoperability Lab, that is constitution of, I think, 11 countries or 12 countries in Asia region. So what they are doing is they are actually developing one core database, so that all the terminologies or all the data that has to be extracted from the different services in Nepal, maybe that can be pharmacy, that can be lab, that can be hospitals. So all the fields that needs to be acquired from the different health information system being used in the hospitals. So we need to first devise that. So what we can call it is NP data core, Nepal's data core for interoperability. So first we need to design that. I think some of the work, actually I'm not part of the that community currently in the Ministry of Health. So I think they are developing that. So that is one of the major intervention that has to be done. And then like we can develop other standards for interoperability, so we can identify how we can share the data from so first we need to design the core database. Then we need to design how all these softwares can communicate with each other using maybe FHIR, and or how we can share the lab related data, maybe using LOINC, or maybe how we can communicate the pharmacy related data, or how we can share the data across the hospital. So latter part we can decide on that. So I'm not an expert on that, but still I'm just sharing what I have learned from the activities that is being performed by the other interoperability lab in our Asian region. Thank you very much.
Thank you, Professor Basanta. I think, yes, that's our last question for this session. Before we close and proceed to the group photo, maybe our Executive Director, Sir Jai, can give a few words.
I would like to thank Dr. Basanta ji for being with us and sharing such a rich experience from Nepal. Really would like to appreciate the efforts being taken. I think universities play a very important role in shaping the career of not only the students or candidates that are part of the university, but also the national the journey of the nation, the national development. So I would like to actually thank. I think what has begun and what has shared will certainly further grow. We would like to hear further developments on these efforts, Professor Basanta, very soon in the subsequent webinars, as well as any news updates that we can actually share with the AeHIN members. And we would like to wish you and team the best in your efforts. Thank you very much.
Thank you very much, AeHIN, for providing this opportunity. I'm really fortunate to be part of this community and looking forward to the collaboration. So I see in the chat that some of the labs are also interested in collaboration. So looking forward to the collaboration and working closely with all the labs and all the interested participants to build the digital health ecosystem in Asia.
Yes, thank you, Professor Basanta, Sir Jai, and to all our participants for making the time to join this webinar tonight. All right, thank you, everyone.
Thank you. Bye-bye.